Assalamualaikum warahmatullahi wabarakatuh. My name is Aiman Muhammad Ishaq and my matrix number is U42500 and 22. Okay, I will talk about COPD, which means chronic obstructive pulmonary disease. Okay, first I will give the definition about COPD. It's a long-term progressive lung disease that causes airflow elimination, meaning it becomes difficult for air to move in and out the lungs. Right. The obstruction is usually not fully reversible and get worse over time. COPD includes two main conditions. Right. The first condition is chronic bronchitis, long-term inflammation of the airway that causes cough and mucus production. For the second condition is emphysema, damage the air sacs that we call alveoli in the lung, reducing the surface area for the oxygen exchange. As a result, people with the COPD often feel short of breath, have a chronic cough, and may experience fatigue and frequent chest infection. Right. I will talk about causes why COPD have in human. The most common causes of the COPD is a long-term exposure to irritates that damage the lungs and the airway. Major causes include first, smoking. The main cause, about 85 to 95% COPD cases are related to smoking. Harmful chemical in smoke irritate the damage the lung tissue. The second is air pollution. For the air pollution, if exposure to polluted air, smoke for the burning fuel or dust in the environment. The third is occupation exposure, inhaling chemical fume, vapors or dust at the workplace, such as the factories, mines, and farm. Okay. The fourth, genetic factor, especially a rare condition called alpha-1 antitrypsin deficiency, which make the lungs more vulnerable to damage. For the last, respiratory infection. Repeated or serious lung infection during childhood can slow lung development and increase the risk of COPD later in life. Okay, how it affect the lungs. In COPD, the airways and alveoli lose their elasticity and become inflamed. The wall between the alveoli can break down and mucus production increase. The causes is first, narrowing air passage, air trapping in the lungs, reducing oxygen exchange. Over time, this lead the chronic breathing problem, disease oxygen in the blood and strain of this heart. For the summary, in short, COPD is a long-term lung disease that makes breathing difficult due to damaged airway and alveoli, most often caused by smoking and long-term exposure to lung irritants. It cannot be cured by early diagnosis. Quitting smoking, medication, and lifestyle change can help control symptoms and slow the progression. So I will pass the next slide to my friends. Thank you.
Hi, my name is Shazim Ismail. My matric number U4250103. Today, I will talk about the symptom of COPD. COPD, or chronic obstructive pulmonary disease, is a long condition that develops slowly over time. In the early stage, COPD may cause no symptom at all, or only mild symptoms that people often ignore. As the disease gets worse, common symptoms begin to appear. These include shortness of breath, wheezing, and a tight feeling in the chest, especially during the physical activity. Many people also experience a long-lasting cough that builds up all of our muscles. When COPD becomes more severe, the body needs to work much harder just to breathe. Because breathing requires extra energy, it becomes more difficult to exercise or even do simply daily activity like getting dressed, walking, or climbing stairs. Over time, this can lead to tiredness and weight loss and loss of muscle strength. People with COPD may experience a wide range of symptoms, and the severity can vary from mild to moderate to severe. To understand how COPD affects the body, it helps to know how healthy lungs work. When we breathe in, air travels down the wide pipe and into the lung through the air walls, also called bronchial tubes. Inside the lungs, these air walls merge into smaller and smaller tubes called bronchioles. At the end of these tubes are millions of tiny air sacs called alveoli. Normally, the airways and ASA are soft, elastic, and flexible. When we inhale, each ASA fills with air. When we exhale, the ASA deflect this movement, allow oxygen to enter the bloodstream so it can be carried to all parts of the body. In COPD, however, the airways become thicker, swollen, and inflamed. They also produce more muscles than usual. These muscles can block the airways and make it harder for air to move in and out of the lung.
My name is Muhammad Ali Ifan. Matrix number U4250141. Treatment: reduce risk factors, managing associated illness, supplemental O2 medication, bronchodilators, inhaled steroids, antibiotics. Quit smoking, eat healthy. Your 30 minutes cardio exercise can add you to lung life, which can help you boost your lung by power 10%. Step out and breathe in for the healthy living. My name is Muhammad Ali Ifan. Matrix number U4250141. Treatment: reduce risk factors, managing associated illness, supplemental O2 medication, bronchodilators, inhaled steroids,